This is Open to Debate. I'm John Donvan. Welcome, everyone, to the third debate of the Hopkins Forum series presented in partnership with the Stavros Niarchos Foundation, Agora Institute of Johns Hopkins University, where we are recording this episode today at the School of Nursing. We are having a debate to assess an experience that I think I can say with a great deal of confidence everyone paying attention has lived through. I refer to the COVID-19 pandemic. It became at a time when millions died globally, not just a health crisis, but also a test of how good we are at coming together or not, at taking the right protective steps or not, at keeping the whole matter above politics or not. No one can dispute that even as legions of healthcare workers and others acted courageously and selflessly at the front lines, our collective response did not get to perfect, not even close. There were missteps, some more obvious now in retrospect. There were lessons learned, many the hard way. It was an episode in our history which in some ways continues today, especially as those who were in the decision-making roles continue today to explore and debate among themselves what worked and what could have gone better. Today we are bringing together 4 healthcare professionals and asking them to give us a glimpse of what those internal debates going on today look like. We are asking this question: was COVID a public health failure, or did society fail public health? This episode is going to be different from any that we've done before because we are requiring that each of our 4 debaters actually argue each side of the question. To repeat, in recognition of the complexity we're talking about and to make room for nuance, we want to hear each debater make both cases, that public health institutions failed and that society failed. Halfway through their opening presentations, the debaters have to stop and switch to the other side. They will hear a little noise that sounds like this, a little sound that goes like this. That's the stop and switch sides sound. One other thing, our 4 debaters each had a specific and extremely relevant part to play when the pandemic arrived, which gives us 4 unique perspectives based on their expertise. We have the former Surgeon General of the United States at the time the pandemic broke out. We have an emergency room doctor who was also a leader at the U.S. Department of Health and Human Services. We have the former director of the Centers for Disease Control who was very publicly working on education during the pandemic, and a practicing physician who took a leading role and still does in public education and messaging. So help me please welcome them to the stage now. I would first like to welcome the 20th Surgeon General of the United States, Dr. Jerome Adams. Next up, a social media health influencer, Dr. Mike Varshavski, better known online as Dr. Mike. Next to the stage, straight from the front lines during the pandemic, emergency room physician, Dr. Dara Kass. And taking our 4th seat, former director of the CDC, Dr. Tom Frieden. Our first debater is going to be Dr. Jerome Adams. I have asked everyone 2 questions, sought their cooperation in 2 ways. I have asked if I may have their permission to interrupt them when I feel the need to. They've all agreed to that. And can we go on a first name basis? Because they're all doctors, we know that. So after this, it's first names. Jerome Adams, you are up first. You are the author of Crisis and Chaos, Lessons from the Front Lines of the War Against COVID-19. You were the 20th. For those who are only listening, Dr. Adams just held up a copy of his book, which is a move I admire as an author. Well done.
My publishers would get mad at me if I didn't.
Yeah, absolutely. I know what that's like. You were the 20th Surgeon General of the United States, a position often referred to as the nation's top doctor. You had that position when the pandemic began. You're going to start off by telling us how public health failed, and then at that 2-minute mark, when you hear that bell, you're going to tell us how society failed public health. So your 4 minutes starts now. Please, and we're going to ask each of you to stand when you speak. You're already up, so thank you.
All right. Well, thank you very much. As U.S. Surgeon General, I was in the room when COVID hit. And I'll say it plainly, the pandemic was a public health failure, not just because of a novel virus or a superimposed election, but because of missed opportunities and preventable missteps. First, our communication faltered. I personally tweeted that masks weren't needed based on what we'd recommended for past respiratory outbreaks. But that message and many others, for example, vaccine efficacy against transmission, shifted too often and without explanation. As you frequently hear lamented, schools were closed, but restaurants and bars stayed open. That lack of clarity and consistency fractured public trust, and when you lose trust in a crisis, it is impossible to regain. Worse, our communication often came with a heaping helping of shame and blame. Any one of you all remember Pandemic of the Unvaccinated? Second, we were structurally unprepared. In my book, Crisis and Chaos, I lay out how decades of underfunding left us with no testing infrastructure, no coordinated data, and frontline agencies stretched beyond capacity. Our response was fragmented, delayed, and overwhelmed, and it cost lives and livelihoods. And many rightly call this a failure of political leadership, but it manifested as a failure of public health. Finally, we failed to center equity. Marginalized communities, immigrants, communities of color, the incarcerated and the elderly all faced higher death rates due to pre-existing disparities in housing, income, and health. Instead of tailoring outreach and care, we delivered a one-size-fits-all plan. Even today, with tens of thousands still dying annually, we fail to treat COVID as the real but differentiated public health threat that it remains, especially for the vulnerable. And this wasn't inevitable. With better messaging, stronger infrastructure, and an equity-first lens, we could have saved more lives. And for that, I apologize to all of you.
Ding.
All right.
Switching sides.
Now let's talk about how society failed public health during the pandemic, because even the best science can't save lives if people don't listen. First, public health became a political football. Again, in my book, I write about how science was drowned out by ideology. And this wasn't just conservatives, you all. The highest-ranking public officials to sow mistrust in COVID vaccines in 2020 weren't Donald Trump or Ron DeSantis. They were Kamala Harris and Andrew Cuomo. Look it up. Public health became a proxy war for partisan politics. As a result, scientists became attacked, advice was twisted, and life-saving tools like vaccines and masks became identity markers. We allowed tribalism and misinformation to divide us, and we're paying the price now with eroded public trust and preventable disease outbreaks. Secondly, our society devalues prevention. We fund hospitals, but not health departments. We praise doctors, but we pillory public health workers who keep our water clean and our kids vaccinated. Public health asked for relatively simple things at the beginning of the pandemic, at least in the context of saving lives and reopening schools. And society pushed back hard, calling them infringements instead of protections. And finally, our decisions favored economics and individualism over empathy. Nursing homes were ignored, and the elderly and immunocompromised and our kids were deemed expendable in the name of reopening. And now we're making it harder than ever for people to choose a COVID vaccine, all while 47,000 Americans still die from it every year, more than car crashes, more than breast cancer. We failed to see public health as a shared responsibility, and we chose convenience over compassion. And unless we change that through honest dialogue, real investment, and kindness for one another, we will fail again. We owe it to our next generation, to my kids, to do better.
Thank you, Jerome Adams. Our next debater is going to be Dr. Mike. In addition to being a board-certified family physician and a UNICEF ambassador, he became a trusted source of health news during the pandemic as an influencer on social media. Mike, you have risen to make your opening presentation. The floor is yours.
Thank you so much. The COVID-19 pandemic was caused by a virus, but for me, it was more of a crisis of trust and lack of preparedness. What we ended up having was not enough masks, not enough ventilators, so much so that a young graduate, recent out of his residency, was purchasing tens of thousands of dollars worth of N95 masks for his colleagues from the gray market. We were having reports sent to the CDC on spreadsheets filled out with pen and paper. We were having faxes be our monitoring service. We weren't sure whether or not we should be counting deaths because of COVID or with COVID. Second, there was the highest ever rate of healthcare polarization. This was happening across the board. The CDC was disagreeing with the FDA. The WHO was disagreeing with the CDC. Mask your kids, don't mask your kids. No one could stay on message. And this is not left or right or center. President Trump came out and claimed that hydroxychloroquine was a game changer. The NIH fact-checked him. His own NIH fact-checked him. Vice President Kamala Harris came out and said that she does not trust Trump's vaccine, ended up getting it. President Biden in August of 2021 came out and said, we have a COVID booster, before the CDC and FDA actually approved them. This was happening across the board, and folks did not know who or what to trust. It wasn't political theater. It wasn't political theater. It was literally a soap opera happening before our very eyes because of partisanship. And then the final issue was the issue of communication. We approached it without authenticity, without humility. Instead, we acted arrogant, we acted overconfident, and that led to confusion. The fact that we disregarded social media as a tool created a vacuum for grifters, snake oil salesmen to break and further destroy our healthcare system.
I didn't know if you needed the cue. Switch sides.
I just want to make sure.
Hang on, let me do it for the listening audience. All right, Mike, switch sides.
So when I was told that I have to debate the idea that society was actually failing us in the public health sphere, I was a little concerned, but I realized, I guess I'm a social media disruptor, so let's disrupt. I wrote 3 bullets down that there was health agency distrust, there was incomplete vaccine uptake, there was hoarding and price gouging. Now, all of that is true, but then I started thinking, if a single student fails an exam, perhaps they were lazy, maybe they were up all night scrolling on TikTok, not studying, I get it. But if the entire student body starts failing exams, this is not a problem of the individual, but rather a systemic dysfunction. So throughout this pandemic, as I said, we were giving incorrect guidance, constantly flipping back and forth. We were not owning up to our mistakes. There was no accountability. Distrust was growing. So the only thing I could think about is about a word that I think we probably overuse as a society, and that's gaslighting. On social media, I definitely see it overused. But I can think of no better example of gaslighting, of victim blaming, than for me to stand up here as a health professional and blame you for our failures. Thank you.
Thank you, Mike. Our next debater is Dara Kass. She wore a lot of hats during the pandemic, often appearing as a frequent media contributor, formerly a regional director in the U.S. Department of Health and Human Services, but most notably, and relevant for this conversation, she was a frontline emergency room physician during the pandemic. Dara, the floor is yours.
And I am standing, in case anyone's curious about the difference between what that was and this is. Okay, so COVID didn't just expose the weaknesses in our public health infrastructure. It was very, very real for me and many, many Americans. I contracted COVID at work in the ER March 15th, 2020, days after New York City went on lockdown. I was amongst the very few people to contract COVID, and when I became sick, it was nearly impossible for me to get a test. I was also the mother of a transplant patient who needed to know if I had COVID. I was fortuitous enough to move my children out of my house before I got sick. So when New York City was going to go on lockdown, I moved all 3 of my children to my mother's house. The personal cost of moving my children out and then getting COVID was crushing. Thank God I did, though, because nobody in my family got COVID. Not my husband, not my children. But my story wasn't unique. Years of chronic underfunding and fragmentation left us ignorant when we needed a system most. Testing and tracing collapsed in those critical early weeks when we might have known who was contracting the virus. We could not protect communities of color, unhoused people, rural people, healthcare workers, and we watched them carry disproportionate burdens, especially in urban areas. Our healthcare workforce was stretched impossibly thin, asked to shoulder burdens like public communication that they were never expected to handle. Should schools stay open? Should they stay closed? These decisions were multifactorial, rooted in public health, local economies, and the tolerance for the risk and other factors. But public health leaders were told to make decisions solely based on information and disease mitigation, not with the intersectional and organizational help that they really needed. But most importantly, it was our government that abdicated the role as a source of public health information. Instead of clear and consistent guidance, Americans got confusion and mixed signals. By any measure, our COVID response represented a failure of our existing public health infrastructure, and we have not learned from our mistakes. This administration is currently decimating what is left of the CDC and undermining confidence in vaccines and other public health measures. The question isn't whether another pandemic will come, it's whether we're ready, and we are not.
Time to switch.
I can do that. I am prepared. Okay. We need to be honest about something. Public health can only succeed if society allows it to succeed. And during COVID, our society failed public health with deadly consequences. Decades of mistrust in institutions, often fueled by people with financial or ideological motives, undermined our ability to act with one evidence-based voice when COVID struck. When public health experts recommended masking, people saw it as government overreach. When we asked people to test or stay at home, they thought we were restricting their freedom. When we advocated for vaccination, our fractured foundation of trust was a terrible place to begin. But the real damage to our society came from polarization and politicization. Life-saving public health measures were turned into partisan weapons, making collective action nearly impossible. We elevated individual freedom over community responsibility, undermining our ability to protect the common good. Our government, again, played a central role in this breakdown, not as a failed scientific authority, but as a failed governing body. By refusing to consistently and clearly communicate public health information, they left experts isolated and exposed them to political attacks. Public health professionals found themselves fighting not just the virus, but a war against their own credibility. Meanwhile, misinformation spread across social media and fragmented news platforms faster than our coordinated public health response could match. These lies moved at the speed of a click, while truth could not catch up. This was not an accident. It was the predictable result of an information ecosystem designed for engagement, but not for accuracy. Here's what we have to acknowledge. It is not that public health failed society. It's that society, specifically individualism and politicization, failed to support or trust public health when we need it the most. And until we're willing to confront the misinformation crisis that made evidence-based decision-making impossible, we're setting ourselves up for the same failures and the next time when our collective lives depend on it. To you, Tom.
Thank you, Dara. And to complete this round, our next debater is Dr. Tom Frieden. He is author of the book, The Formula for Better Health, How to Save Millions of Lives, Including Your Own. He looks at public health solutions in his new role as president and CEO of Resolve to Save Lives. A reminder, Dr. Frieden was a former director of the Centers for Disease Control and Prevention. Tom, the floor is yours.
Public health works. CDC and other public health entities failed to the extent they didn't apply the basic public health principles. But we have to understand nuance. The virus changed during the pandemic. We developed a vaccine in record time during the pandemic. We learned more about the virus, our immunity, the vaccine during the pandemic. You can think of the pandemic as having had three phases. Before there was a vaccine, when traditional public health measures could have, and in many places did, make a big difference. When vaccine first became available, when it was really important to roll it out to the people who were at highest risk of death, especially seniors. And then when the Omicron variant came in and spread like wildfire, and traditional measures would be much less effective controlling it. The first failure of public health was speed. When the CDC test failed in February 2020, it was a catastrophic failure. It resulted in devastating, deadly spread throughout New York City, the Northeast, and all of the US. The second major failure was the application of vaccine mandates. This was a mistake. Once we learned that vaccines primarily protect you, not the people around you, vaccine mandates became more like motorcycle helmet mandates than school entry requirements. It's one thing to mandate companies not to poison our air, our water, our food, or make products that are going to make us or our kids sick or unsafe. It's another to mandate healthy people. And the third mistake was the school closures, which we knew in advance, had it been studied in the context of a flu pandemic, would cause devastating economic, social, and economic harm. Public health works. Public health failed to apply the basic principles.
Bell. Switch sides.
Public health works. As you'll read in my new book, The Formula for Better Health, How to Save Millions of Lives, Including Your Own. Public health succeeds. I had to do that, Jerome. Public health succeeds when it's empowered to succeed. That didn't happen during the pandemic, and all of us paid the price. We pay 300 times more for our military defense than we do for our health defense. But no war in American history has killed 1 million people as COVID did. The first failure to apply basic public health principles in the Trump administration in 2020 was a failure of organization. That is the first principle of how you deal with an epidemic. You determine who's in charge, you come up with a strategy, a plan, you assign roles. That wasn't done for all of 2020. There was colossal lack of organization. It wasn't clear what the strategy was, who was in control, how we were managing testing, infection control, hospitalization, and more, and most importantly, communication. The communication failure was the most important failure. The CDC actually wrote the book on how to communicate in a crisis. Be first, be right, be credible, be empathetic, give people practical things to do. Every one of those principles wasn't just ignored, it was contradicted in the first Trump administration and also in the Biden administration. When you have a Democratic president telling people to get vaccinated, Republicans don't want to get vaccinated. These were big communication mistakes and they were terribly costly. It wasn't just Trump. Mayor de Blasio ignored the health department. Because of that, New York City's death rate was 4 times what San Francisco's was. If New York City had the same death rate, 25,000 New Yorkers would still be alive. But if the US had Singapore's death rate, 1 million Americans would still be alive. And it wasn't just about the response. It was the pre-existing conditions in our society. Chronic disease, weak primary health care, a lack of trust, but public health works. And if we invest in it, we can address the next pandemic and the ones that are affecting us now much better.
Thank you. So I was nervous about whether this would work, this switching sides thing. We've never done it before. And frankly, you all nailed it. So thank you very much for doing the homework and the effort of doing that. So we're going to have now a conversation based on these openings. And I expect there'll be some agreement, disagreement. That's why I talked about nuance at the beginning of this. And I want to encourage you to feel also you're having a conversation among yourselves. You don't need my permission to speak. You can add to one another, interrupt one another, question one another, challenge one another.
Well, can I take 30 seconds and respond very quickly to 2 quick points? I wanted to respond.
Could you wait till I do one little bit, and then I'm going to come to you first, which I was going to do anyway.
Because I was taking notes like a good debater. Yes, I'd like to react. Yeah.
Just go for it. Jerome, go for it.
Well, just 2 quick points. One to Tom, and I know he agrees with me on this, but I for the sake of the audience, when he talked about mandates, I just got my flu vaccine yesterday, and I have to do it as a requirement to work in the hospital. I'm military. I'm former military. You have vaccine mandates when you're in the military. Mandates, it's different when we're talking about mandating for students or mandating for certain workplaces, but in the hospital, as a physician, and I still work in the hospital, I have an obligation not to make my patients sick. So I just want to be clear that mandates are appropriate even for vaccines that don't prevent transmission well. The flu vaccine works about as well as the COVID vaccine does in terms of preventing transmission. And as I said, I just got my flu vaccine yesterday because we have a hospital mandate, and I am okay with that because I don't want to make my patients sick. Number 2, to the point Mike brought up about gaslighting. I think that's a strong word to use, but to use as analogy. If everyone in the school was failing every year, and guess what? You had a chance to re-elect the president every 2 years or every 4 years, and you kept re-electing the same president, that stops being the president's fault. That starts being your fault. And so while I agree that leadership has failed, we've failed to leverage our democratic tools to actually help people understand that they're failing us. We keep the definition of insanity is doing the same thing and expecting a different result. We keep doing the same thing electorally, and we keep getting the same result, and then we keep pointing fingers at the people who we put in charge.
But we had we had a Republican president and then a Democrat president, so we did swap. Mm-hmm. And the results didn't change.
We swapped. I've done a lot of work in other countries, and I actually would contend, and this is a whole different debate, but our two-party system is failing us. Switzerland and Ireland actually have the same constitution we do. They took our constitutions and wrote theirs based on ours. Our system isn't what's failing us. They have more options. So if you say black, I have to say white to get elected. If you say right, I have to say left to get elected. And so you actually said it perfectly, that we switch to the other. Well, why is the other the only other option? Why don't we have multiple options to deal with an issue?
Okay, we're going to debate the democracy instead, everybody.
That's a big part of this.
To debate democracy.
I am totally prepared to debate the democracy. I just need 2 more minutes to just write some notes down.
All right. I'm going to intervene at this point.
Thank you.
I'm going to intervene
Tom,
because I want to...
No, I respect you greatly. I'd love for you to respond to the mandates comment.
Yeah, I think.
Could you hold for a moment?
He's lost control already.
I know. This has never happened before, but that's because you were so super in those openings. You got... What happened to the humility thought, you know? Actually, I want to mention that what I heard in your openings was, in fact, a willingness to be self-critical. That's unusual in itself, that all 4 of you were willing to do that, and there were references to humility, at least in the negative, when the point was made by one of you that you felt that public health had become arrogant and that was a mistake. But I just want to talk about the other themes that I took notes on. Strong statement from Tom that public health works, but also that it wasn't applied correctly, that mandates were a mistake, school closures were a mistake after a certain point in time. Many of you referred to misinformation. You talked about lack of preparedness, just not being ready for it. You talked about a lack of trust. You talked about the failure to serve marginalized communities. And a lot of you talked about being, I think, frustrated by our elected officials along the process. What I think that where there's a little bit of blurriness may be what we mean by society, because in particular, Mike, you said that you feel like it's blaming the victim to be saying that society failed, but I think that might be the case when we're talking about ordinary people, not people in power. Or does society include the media, as Dara was saying, that the media messed things up? That's also society, and was part of her argument. So this is nuanced, and there are things to sort of sort out. But I'd like to go back to the loss of trust and kind of put this question, and I was going to go to you with it first, Jerome.
I've already talked. You can come back to me. Okay. I'm happy to take it, but yeah.
All right, I'll take it to Tom then. When we talk about the loss of trust, is trust lost? Is the failure when trust is lost due to those who have lost trust, or are those who are no longer trusting, or those who are no longer trusted?
Trust is the one thing that you can't surge into a community during a crisis. You can surge in ventilators and doctors and hospital beds and medicines and vaccines and other things, but you can't surge trust. Trust is easy to break and hard to build. And it has been breaking for a long time, and COVID broke it a whole lot more. One of the core issues does have to do with communication and humility. If you go back to February of 2020 and you look at what Dr. Nancy Messonnier said, was the head of the respiratory branch at CDC, the person in charge, the person who had spent her whole life studying and waiting for something like this. She said, it comes down to the need to be humble. We don't know what this will be, but we do know it could be bad. We do know that disruption of everyday life might be severe. She was leveling with the American people, and that was the last time she was ever heard from. Because the Trump administration saw the stock market went down, and it was at variance with the complete violation of all of the principles of communication in an emergency that were being on display in that administration, saying it would go away like a miracle. So I think we had a pre-existing society with a lot of fragmented, fractured, different groups, and then you didn't have clear communication with humility that says, based on what we know now, and it may well change, this is what we're recommending, this is why. This is what we know, this is how we know it. This is what we don't know, this is what we're doing to try to find it out?
But that was so clear from day one, right? So let's all remember March of 2020 when we heard, not only was this thing terrible, but by the way, it was going to be done in 4 weeks, right? Like, let's remember what really happened. So when you think about the building of trust in the communication, I'm an emergency medicine doctor. I spend a lot of time giving people bad news with incomplete information and walking them through next steps. I don't have all the answers the day that I see them, but I have to give them what information they need to make the decision about whether to stay in the hospital, whether to get medication, whether to have surgery. That's kind of what COVID was in the beginning. And what really happened from day one was the minute that a single public health official came up and said, we don't have all the answers, these are the questions we're asking, they were removed from the podium. And they were replaced with somebody that gave false hope, told them to inject bleach, told them to be over by Easter, told them the numbers didn't matter. If you didn't want to test, you didn't have to know. And yet they were seeing in their communities people getting sick, people dying, and they had to reconcile with the fact that the public could not trust the messengers out there. Which brings me back to what you quoted that Andrew Cuomo and Kamala Harris said about the vaccine. What they really said was, we don't trust Donald Trump to tell us to take the vaccine.
That's not what they said.
Let me
That's
finish.
not what they said.
Okay, now you're interrupting me,
But
which
that's
is
not what
totally
they said.
cool. Okay, so I am telling you that what I remember is that they said, if the scientists tell us the vaccine is appropriate, we'll take it. And the reason that I bring that up is this. The president stood at the podium and said over and over again, we're going to tell the FDA to approve a vaccine, which was different than the process had been in the past. And the reason that that's important, and especially now, is our processes matter for public trust. And if we break them over and over for political convenience, for some other metric that is new to us, then we're not going to be able to get people to listen when we actually need them to. So the only reason I brought that up, Jerome, was that she took the vaccine when it was approved by the FDA and when the scientists said it was appropriate, because that's who we should be listening to for the vaccine. It doesn't mean it's who we should be listening to. Thank you. I'll take an applause. It doesn't mean we need to listen to Anthony Fauci about whether or not schools should stay open. And I think that goes back to all the decision-making and all the messengers. We lean too deeply into public health messengers telling us everything because we elevated nobody else. And we put them in a position to be mistrusted because people said, well, they don't know if schools should be open, and they're making too many decisions. They have too much power. And that wasn't an appropriate use of public health.
Okay, Mike, I want to ask you, we've been hearing about the message changed as the science changed, but when the public was told or hears now that the science has changed, therefore the recommendation has changed. Can that message be delivered in a way that does not undermine trust? Or does the very fact that the same person is saying, we recommended this 6 months ago, but no longer, is that a trust killer? Is there a way to navigate that?
I think you have to be 100% transparent, because if you ever caught lying, you could lose trust in a blink of an eye. As was pointed out earlier, you can't surge trust into a community. We have love at first sight, but we don't have trust at first sight. It takes time to build that trust. And that's why I was really disappointed, actually, from the CDC and all these organizations, even prior to the pandemic, of not having a social media footprint, of not being there to fact-check misinformation. It was actually a policy of the CDC to not fact-check misinformation about vaccines. And because of that, we had this gray zone that I talked about, where people came in, learned how to use the platforms, the algorithms, and now when Secretary Kennedy comes out and makes a tweet and gets 10 million views on his tweet, it's so influential. But when we do it so unsuccessfully because we hold our noses up in the air as a healthcare community, as we're geniuses, we're researchers, we're smart, we know what's right for you. That's not the way we need to approach it. We need to approach it with the transparency that we do with all our healthcare decisions on an individual level.
Are we back to the humility question in that?
It's humility, but even this combative rhetoric that we're seeing here right now, like Dr. Kass, you're pointing out flaws of Donald Trump, perhaps inaccuracies of what Vice President Kamala Harris said, but you frequently talk about demystifying healthcare, translating it for the general public. I'm curious, outside of your hospital experience, where do you do that?
I did it today when a friend's parent got a diagnosis of cancer.
So Secretary Kennedy talks to 10 million people, and we're doing it on an N of 1. When I look at your social media platforms, you post really good quality content, top research. It gets 6 likes.
Right.
It's useless. I'm sorry to say.
No, I don't mind. I don't have a staff.
I don't have a staff either.
Well, I
But
know. Yes. Okay.
The CDC has a staff. The HHS has a staff. we need to take social media seriously, because when we go on the same stations that are partisan in nature, MSNBC, we talk for 30 seconds, we think we won something because people applauded for us. You're not changing anyone's mind. You're not winning the general public over, and we're consistently victim blaming people who are trying desperately to understand the message we're sending out to them.
Can I make a practical point to agree with you? Because that's literally a chapter I have in my book about, it is, about
Do you want to mention the name
about
of your book
communication
again?
Crisis and Chaos, get it at your local bookstore. No, and if people will remember, Donald Trump was really the first social media president. He was the first Twitter president. And people will also forget, you'll remember, in early 2020, before COVID, in very early 2020, we were having debates about nurses on TikTok and people dancing in the operating room and whether that was ethical or not. We were having a conversation about that. And then all of a sudden COVID hit, and everyone was home, and then everyone was on social media. And so I was in the middle of that, trying to navigate that world. And to your point, the Surgeon General runs the 6,000-person Public Health Service Commission Corps. I was running a 6,000-person company and doing my own social media. So one of the lessons is that we need to give public health people more help doing social media. Number two is that we actually need to give everyone, every single one of you all students in the room, need to have at least one training course. So if you ask any of us as doctors a medical question, we are trained to prepare you a 30-slide, 45-minute PowerPoint presentation to give you an answer. We are not trained to go on TikTok and explain it in 30 seconds, or to go on Jake Tapper and explain it in a 3-minute combative interview. But those are skills. Those are real skills that other people have, and it's why Joe Rogan is handing it to us. And Kennedy he is very good at communicating to the public. And so to Mike's point, he's actually getting more people to view and absorb his messaging than what we are as physicians. I couldn't agree with you more.
I just would want to make one quick point, which is I agree with you. We're pretty pathetic at social media, many of us, but we can't ignore the money behind the misinformation.
Yeah.
That it's paid for and it's funding an industry. It's funding an industry that's selling dangerous or useless things. It is deadly, debunked, dangerous misinformation, and it's being sold for a profit. And that's one of the things that we have a hard time competing with. Plus, you've got Brandolini's Law. That takes a whole lot more time to correct a lie than to tell it.
And that was a real concern that they brought up to us, because if you also look at the science behind communication, and we had this debate when I was Surgeon General about debunking. And the problem is, I had 1 million followers when I was Surgeon General of the United States. If I reply to someone who has 10 followers, I'm actually amplifying their misinformation. And so people were all the time like, reply to this, reply to this, reply to this. And so it's tough, because sometimes you're amplifying misinformation and doing more harm than good. But again, we need experts, and we need training to understand when to intervene, how to intervene, what medium to use, and so that we're not preaching to the choir, but really talking to our target audiences.
One of the critiques that was raised also by a couple of you was the lack of preparedness. And I want to try to do a little bit of a pivot to what do we do for the next time. Why were we unprepared, and how to be prepared? What constitutes preparation?
Tom, what did you learn during Ebola? Because you were the CDC director, and I was the state health commissioner during Ebola.
And I want to finish that, because I remember one conversation I had in the ER right before this happened with a friend of ours that I still quote to this day.
So, in many ways, this was the big one that public health was supposed to be ready for. And in many ways, we did blow it, right? Now, it was very different in different places. We can debate forever, and we will never agree how COVID started. But we can be certain that we're not doing nearly what we should be doing to reduce the risk of laboratory leak around the world, or to reduce the risk of spillover around the world. And we could be doing much more to reduce both of those.
So best case scenario, what could be done now?
We invest. I hate to do this, Jerome, but I outline this in my book.
It's contagious.
Yeah, a strategy. It really is a formula: see, believe, create. You've got to see what the problems are, see the past path to progress, make steady progress to build confidence, and create a healthier future, we can make it much less likely that the next pandemic will be as deadly as this one is. We can stop epidemics where and when they start. That's a more efficient thing to do, but that requires investment. That requires investment in tracking systems so we know what's happening. It requires investment in staff who train. It means a resilient primary healthcare system. It means a robust community with less chronic disease, so we're less vulnerable. And it means really a renaissance in public health, because public health has done great things in the past. It's why we're healthy today. We've eradicated smallpox. We stopped Ebola. At Resolve to Save Lives, we've worked with more than 50 countries to eliminate artificial trans fat. That will prevent 9 million deaths in the future.
Tom,
public health works.
I understand you've written a book. Something that you say in your book is that it would be great if you could walk down the street and say, that person's alive because of public health, and that family's okay now because of public health, but you don't, the institution of public health doesn't get credit for the lives that aren't lost.
It's impossible to quantify harm averted.
Yeah.
It's not impossible, it's just...
It's very difficult.
It's easy to quantify, hard to see.
Yeah, exactly.
Where does that challenge fit into the notion of trust? I mean, is there some message that your profession, your field should be putting out that tells people how well off they are? You know, for example, the whole vaccine question right now, it's much easier for people to say, I'm not worried about measles because the program's been so successful for 60 years.
Public health in general, and vaccines in particular, are victims of their own success. The very things that ensure progress make it less likely the public will support that progress. The solution to that is not to wring our hands more loudly, which seems to be what public health often likes to do. The solution to that is to organize our activities so we're more likely to succeed, to simplify our messages so that they can be understood, to communicate effectively, including and especially on social media, and to overcome the barriers, because there are structural barriers. There are industries that profit from making people sick, and we have to control them or more people will get sick and die. And we can do that. We can learn. You know, Coke and Pepsi hate each other, but they get together to block soda taxes. You don't see soda taxes being talked about when we're talking about making America healthier,
let me
but they're the
because
single most effective thing you could do to reduce
I
obesity.
see frustration coming across Mike's face, I think.
Okay.
I just think I'm surrounded by brilliant people who are not closing the loop of having their message land.
So what do they do? What are you doing that they should do?
It's not even what I'm doing. I look at the AMA, for example. Secretary Kennedy comes out and defames every doctor in the United States. He says we're interested in profit. We're interested in keeping our patients sick. It disgusts me to hear that. It literally does, because I'm there for my patients. And the AMA issues a strongly worded tweet that gets 5,000 views. They put the president, Dr. Mukamala, in front of a webcam.
But what's the answer?
Be more effective.
But
Learn how to
what's more
communicate on
effective?
these platforms.
Yeah, wait, but
Wow.
Understand how to do it.
Well-
If I've reached out to the AMA to work with them to help prepare their messaging, to get a production crew with lights and a camera and a microphone that works. How do you expect to have the general public trust you when you put zero emphasis in talking to the human that is across from you with a public health message? We have amazing books, sure. We go on TV shows that no one watches, sure. But are we ever going to care about the fact that this message is not landing for anybody? I don't know.
Well, shout out to Dara, and I want to tee you up here because I want to give you all a practical answer to this question. Even though people's trust in healthcare and hospital systems is at an all-time low, the number 1, 2, and 3 people or institutions that people trust for health, not institutions but individuals, are their doctor, their nurse, and their pharmacist. And you are our local doctor here. I mean, and I think what we need to do is empower individual physicians to have these conversations and not just say it's on the CDC to convince people to get vaccinated.
I think it's
No.
I think it's also like it's structural. Like I agree, like you have a huge social media platform and it's working for you because you invest a huge amount of time and money into it, and that's wonderful. Every physician in America doesn't have that capacity. So the idea that we would all have to rise to the occasion of getting to do TikToks and videos and green screens where I'm pointing and I'm saying, and all the, I mean, that's impractical, right? The truth is that the bully pulpit, both from the administration and from the current Secretary of Health and Human Services, creates content that gets shared organically and by farms because it is inflammatory. And the idea that you have to hit inflammatory content with accurate content is never going to win, no matter how good your content is, no matter how, how great the AMA statement is. No, it's not inaccurate.
I'm sitting in front of you with 14 million subscribers.
That is, you are an N of one.
I started in residency, broke $300,000 in debt. We have the CDC, the richest organization of the United States, with our healthcare budget.
But they don't
that is
spend money
through
on
the roof.
that. No, you're right.
Yeah,
they
exactly.
don't.
So why are we not spending
Because
money
no, it's
on
not
that?
us. It's Congress. It's them. I was in the administration at the second half of COVID. I also was there when we were seeing reproductive health care get taken away from every woman in the United States. And at the end of the day, there is no budget for communications in the federal government. The HHS has a office of public affairs with no structural advertising budget. Yet pharmaceutical companies have advertising budgets. Podcasters and YouTubers and all those people have advertising dollars. Unfortunately for
No,
us,
we don't.
Just
You
one.
do.
I've spent $0 on advertising.
No, you get
in my career.
advertisers.
So?
That's great. It's a business model. My point is
What does that
our-
have to do with the messaging? The messaging, like to go on MSNBC and get applause from the same partisan people that already agree with you is different than going and surrounding yourself with anti-vaxxers who desperately disagree with you. Who has done that from the CDC?
Okay, I understand what you're saying. I also think there's a whole conversation about toxic rhetoric right now. If you put yourself only in front of a group of people that want to throw jabs at each other, you're not actually having a conversation. Maybe it's better to sit here and have a town hall with a bunch of people, let them come and ask questions calmly, not for viral clips, not for memes, but actually for conversation.
Okay.
To me, that's what we should
I want to
go.
let Tom come in, and then we're
Sorry.
going to go to questions from you and our
A really
audience.
quick point. The sky hasn't fallen. 92% of American parents get their kids fully vaccinated on time. There are real problems with lack of trust, misinformation. We must do much better. But most people are with public health. Most people want to see a healthier future, and we can build on that and grow that trust.
Okay, I'm going to come to you for questions now. I'm doing this because of the light in my eye. I won't be able to see without doing that. But if you raise your hand, great. And I'm going to probably, in the beginning at least, be favoring people closer to the aisle just because the mics are easy to get to you over there. And the reason I say that is I'm loath to give the mic to a member of the audience because then sometimes we can't get it back. But if you would promise to really ask a really tight question and to stop when I say that's good enough, that's enough, then we can send the mics down to the middle. But we have somebody right over in the aisle. And
If you have a book, also make sure to hold it up and tell us all about it.
and if you could tell us at least your first name and stand up so that the debaters can see you.
Hi, my name is Fiona. I got my master's here in public health, mental health, and also work here in the psychiatry department now. My question is, I'm hearing a lot of you talk about like how to talk to communities. I'm not hearing a lot about how to talk with communities. Like you're talking about what you're going to say to people, not how you're going to hear people's concerns and respond to them. So I was wondering if you could talk more about that sort of thing.
That was by the way, a perfectly constructed question. Thank you. That's the model that we're looking for.
Communication starts with listening. Communication starts with listening. And this was a failure in many places. But
Why, Tom?
One thing my organization did in 20 countries in Africa was to start a survey where we asked thousands of people and we collected data to see what people were thinking. And there was quick feedback. Good public health uses data systems, uses data loops to change behavior. For example, it was quickly in these African surveys that people could not tolerate the open markets being closed. It didn't make sense, and that was where they got their food. They were quickly reopened, and they retained trust
Tom, let
of
me
the
jump in
people.
because I take your point that listening could be better. You're giving an example of it, but why was there a failure of listening, especially when social media was full of voices saying stuff?
I don't know the answer to that.
I think some of it was that we weren't in person, and honestly, we didn't believe each other. We didn't believe that you were a real person on social media. We didn't really care who you are because we lost our sense of interpersonal communication. I also think we didn't accept that different people have different risk tolerances, and different communities wanted to make different decisions. And so instead of shaming communities that wanted to stay open, knowing that the virus would spread maybe amongst people, or other communities that wanted to keep masks on longer or wanted to have vaccine requirements to open schools, we flamed everybody for not being exactly in line with whatever the central recommendation was. And I think that is probably, to me, one of the things I would do differently the next time, is even allow a federal government to provide kind of a menu of options that allows for but has an honest conversation about the costs of those decisions. You may see higher death rates amongst your older people to open up schools. You may have to offer teachers an early buyout because they want to retire because they don't want to take that risk. Those kind of conversations we never had. We were not honest about the costs of our decisions. We just gave blanket recommendations and didn't listen to what people wanted.
That's actually, and again, I am not trying to sell my book. I give away books. But I tell the story in my book about
Jerome, you can still answer the question without the reference to your book.
No, but I want people to, if you want more information, I literally tell a story about this, where earlier on in the pandemic, a lot of the communication that we were having was from the White House, from Washington, D.C., through CNN, through Fox News, through these national news channels. And it was a very different type of communication where we literally were behind a podium talking at people. And it very much changed when Deb Burks actually said, we need to have a 50-state strategy. And she, myself, Bob Redfield, and Tony Fauci split up the United States, and we went out to the states. And we would visit with the governors, and we would go out into communities, and we would actually sit and listen to them. And Montana had a very different approach than Michigan. Boston had a very different approach and very different problems than Boise. And so, to your point, when we shifted our communication and our interaction with the public from one where we were pushing information out from one central location to one where we were actually sitting with people and hearing from them, it completely changed the way they interacted with us, how receptive they were to our information. And Deb was really good about this. She gave us sheets for every community we went to. So we could say, here are your COVID rates, not how many people died nationally of COVID, because that matters very differently. It's very differently in New York than what it does in Nebraska. Here's how many people died in your community. Here are your laws, because the laws and rules and regulations are different. And here's what we think you should be doing. One of my lessons is that people need to know that you care before they care what you know.
I'm just going to jump in so that we can get to some more questions. Thank you for that question. It really got us to an interesting place. Right in the aisle there, sir, if you could stand up. There's a mic to your left. And I'll start coming to the other side.
So actually, this falls on what you just said, which is, public health. We keep on talking about public health as if it's like one thing, but really it's lots and lots of things. We have a very decentralized system. And so I was wondering actually if you could talk about are there one or two examples of which were real success stories during the pandemic?
Great question.
And, should they be models for the future?
Great question.
Operation Warp Speed. I mean, it's the greatest achievement of the last 75 years.
Can you remind people what you're referring to?
The development of the COVID vaccines, particularly the mRNA vaccines, but it wasn't exclusive to the mRNA vaccines. I mentioned that because we just defunded mRNA technology. But the greatest achievement, bar none, in June of 2020, Tony Fauci and Bill Gates both were still predicting it would take 18 months before we had a vaccine. We had a vaccine by the end of the year. The Lancet predicts that anywhere between 8 and 15 million lives were saved because of that speed. So it was a great success, and my involvement with Operation Warp Speed was in increasing the number of people from diverse populations in those clinical trials. That was also a success. Not only were they the largest and fastest trials in history, but they actually ended up being among the most diverse clinical trials in history.
So I'll take it what you said, if you don't mind.
No,
the
go ahead.
dissemination of the vaccination was actually a huge success. So actually that was a transition of the administrations, and there wasn't a lot of preparation into getting vaccines into arms, at least not from what I saw when I was at HHS and on the ground. But when the governors got the vaccines and then leaned into their communities, their county, and that was funded, which was kind of amazing. There was funding for that, funding for vaccinations, funding set up pop-up centers. So I spent every day, I wasn't in the ER, vaccinating people to COVID. I would do 100 vaccines a day, which was so good for my own health, my mental health, because I felt like I was healing from the trauma of watching people die. And people showed up in droves to get vaccinated. And so I would say that the vaccination outreach and program that first time was by far a huge success of public health because we finally had the funding and the communication to back it up.
Okay, another question. Anybody on this side? Right down front. We can bring the mic around to you. In second row, please.
Hi, I'm Emily. I'm a current master's in epidemiology student here. I had originally considered going to medical school, but after the pandemic, I saw how broken the healthcare system became. So as physicians and practicing physicians yourself, how do you feel that the pandemic either failed or made better the medical teaching that we see nowadays?
So the failure is why you decided not to become a physician.
Yes.
Still true.
I chose to go into public health now, specifically epidemiology, to try and help better educate people on infectious diseases specifically. Not just because of the pandemic, but because of what I was seeing in my own hometown, very rural community.
And did you feel it was a failure of medical teaching? Because that seems to be what your question is about.
Yes.
Okay.
Can I tell you a secret? Yes, it was horrific to watch what this did to the public health to the healthcare workforce on the ground. This made us tighter than ever anything else. I love being a doctor. I would never give it up, ever, because it's a gift to be able to be part of healing people, to be part of that process. But I look at my fellow physicians, my residents, my other attendings, and I revel in gratitude that I can still do this job. We went through war together during this pandemic, but we survived, at least some of us.
How do the rest of the doctors feel about it when Emily's decided?
I think we learned that medical inertia is a real thing, and we need to not make the mistakes of yesteryear. 20, 30 years ago, medicine used to be practiced very paternalistically, where we decided what was right for our patient. Now we've come to realize that it needs to be a team approach. We need to be the ones providing guidance, information, and allowing the patient to choose for themselves what the right approach is. And I think that's what strikes at the heart of AI, why AI won't replace us as physicians. Because I know pilots certainly didn't get nervous when Flight Simulator came out. AI is just information. It's what we can do in teaching the human that's in front of us with that information, understanding how it applies to the human in front of us. That's the art of practicing medicine. So I think we have gotten better at that.
Mike and I were backstage talking about how we both still work with residents. I mean, and I love it. And while I completely understand where you're coming from, and I counsel undergraduate students, graduate students, medical students, residents, all the time about careers, ultimately it comes down to you've got to be the change you wish to see. And so I'm still there. I was the first Surgeon General in modern times to continue practicing while I was Surgeon General. I continued to work at Walter Reed Medical Center with residents working with wounded warriors. I practiced during COVID while I was Surgeon General. And so I'm there because the system is broken, but I want to be a part of making it better.
Between public health and academic medicine, there's been a long tradition of mutual disrespect. And we're both going to be much better off if medical care and public health work together.
Yep.
On the far aisle there, yep, if you could stand up.
Hello, I'm an undergraduate at the Homewood campus. And I guess when it comes to the pandemic, one of the lingering questions that we still have is the origin of the COVID-19 virus. And I know now we've seemed to be more open to debate and more open to considering the different theories of whether it was a lab leak or whether it was a natural mutation. But to me, when I began seeing the news, and that was especially during the COVID-19 pandemic, there was almost this presumptuous, obstinate certainty of where the COVID-19 pandemic came from. That we now, with more evidence, are realizing, maybe there are other theories and sources that we should consider. And a theme was intellectual humility. So I wanted to just bring that back to you as a question. In future pandemics or future public health problems, what do you think the role of intellectual humility should be for our public health elite?
And that humility would be manifested by not saying anything with such certainty about something that's not certain, is what you're saying.
Yes. Yeah, I think it's a great question, and it's really, really important. Scientific excellence doesn't lead to certainty, it leads to humility. And that's why what Nancy Messonnier said at the start of COVID was so important. And if you look at what many people were saying, fundamentally it was, we really don't know. I could do 2 minutes lab leak, 2 minutes spillover. Really, you can make a strong argument for both, really strong argument for both. And I might have a stronger belief about one or another, but it's a belief. And ultimately, in this case, for that specific question, it doesn't make a lot of difference because we know right now we're way too susceptible to the next pandemic from each of those things. Lab leaks, smallpox leaked, SARS-1 leaked, flu, 1976 probably leaked and caused a pandemic. So it happens. Spillover, Ebola, Marburg, it happens. SARS-1, MERS. So yes, we should look at that carefully. Yes, we should be humble, but we know right now there's a lot more we could do to drive down the risk of the next pandemic, and we're not doing it.
I was just going to chime in. The fact that doctors are taught to hedge, so every time a patient comes in, we don't give a single diagnosis. We give a differential of multiple things it could be. We don't say this treatment is certain to work. We say this treatment is probably ideal. Here's the reasons. But if it doesn't work, here's option B and C. But then you have people like Gary Brecka go on social media and say, oh, you have headaches? It's because you're not consuming enough pink Himalayan sea salt. So we're always at a disadvantage because we don't sound confident enough because we're always hedging. But I think if we change their narrative and say that the people who hedge are the honest ones, I think that's where we can come out ahead.
Can I give a unique answer to that? So number one, and again, in the moment, one of the challenges that we had that you all will remember when I bring it up is that people were talking about the Kung flu virus and the China virus. And there was a lot, a lot of people, but one in particular. But
we're not going to name names.
Well, that's not the point. The point here is that there was a lot of pressure, fair or not, on people to say it is not coming from a particular place that will allow these groups of people to be stigmatized. So I think that's something to remember. I'm not saying it's right or wrong. I'm just telling you that was the context for some of this, push to feel like we have to say that it's not coming from here because there's no data coming from here. So remember that, number one. And number two, another challenge that again, a particular person had involvement in this decision was our withdrawal from the WHO. And it's going to make it very hard in the future for us to explore any of these options if we don't have international cooperation and data sharing. And so those are two important aspects to solving this problem, in addition to your great point about intellectual humility.
So normally this is the point just by virtue of the clock where we stop, but this is going so well and your questions are so good, I want to add another 10 minutes if everybody's okay with that. Yeah. I mean, everybody's like really riveted by this conversation. I can see your faces. Nobody's on the phone. Whoa. When does that ever happen? Right in the center, sir.
I would like to see some of the people comment on the effectiveness of the isolation and the lockdown strategy. I come from New Zealand, where we're very fortunate to be able to close off the airplanes coming in and put you on 2-week quarantine, but whether any of those lessons could be applied here.
Absolutely.
And what other lessons, by the way?
Well, again, public health works. And before the vaccine, before Omicron was a tidal wave. These things wouldn't be very effective in Omicron. But the places that did contact tracing, isolation at scale, the places that use masks more, had way lower mortality rate. The death rate in Singapore is 200 times lower than the death rate in the US, 200 times. They followed public health practices and advice. They had their problem. They had one large kind of a housing project for workers. They had a huge outbreak there. They were able eventually to control it, but you have to do public health right, and you have to support it for it to work.
I think Dara brought up a great point earlier about we really need to understand. So the difference between New Zealand is like the size is smaller than Texas. And so one of the challenges we have is we like to compare ourselves to these other countries, to Germany, to France, to New Zealand, to Denmark, to Sweden. And the reality is that they aren't the size of the United States, they are the size of a state. And it's hard to compare scale. But that said, I think our role is to go to these different places and say, here are the public health tools that we have available. Here are the trade-offs. So in California, Gavin Newsom said, we're going to shut down Disneyland, and we're going to keep it shut down because I'm not willing to sacrifice a single life to open Disneyland. And in Florida, Ron DeSantis said, we're going to open up Disney World. And both of those states have the right to do that. But what we need to do is make sure we're being honest intellectually, economically, and from a health perspective about the trade-offs so that people can judge what happened and then actually exercise their democratic right to vote for it or against it the next go round.
We also didn't take into consideration the environments people were in. If you were in school in California, like in LA, you had outdoor hallways.
Yep.
Those schools were much easier to open up than schools in New York City that are underfunded, historically have poor ventilation, and there's 5 schools in one building. So I think that we need to also remember there are other factors besides just masking and disease transmission that would factor into which communities could open. And again, you saw the southern states open earlier and not see necessarily as much devastating harm. And they were like, see, told you so, nanny poo-poo, which goes back to your point about humility. Because you cannot have humility and expertise if you don't have grace. And we had no grace as a community for people being wrong or trying to change their minds. And so it was gotcha, told you, you were wrong, you didn't know what you were talking about, and that was coming from the highest levels of leadership and the communities themselves. And until we realize that people will make mistakes and we have to learn together, we're not going to do better the next time around, no matter how many CDCs we fund or any other decisions we make.
Speaking of the last time around, Mike, why do you suppose that your audience just soared during the pandemic? What were you doing that got them to listen to you?
I was there for them. I was answering the questions they had. You mentioned this earlier, Jerome, when you said that you didn't want to give air to misinformation. And we were very careful about that and considerate because we wanted to make sure that if something wasn't popular, we didn't make it popular. But if something is being said and everyone's talking about it, or someone's a New York Times bestseller and already reaching millions of people, we're going to fact check it. So we were just happened to be there. In fact, there should have been no reason why I was the primary voice on the world's largest video website giving medical advice. It should have been these physicians by my side. But because no one took torch to actually be there, I said, I have to be there. I have to be the family medicine doctor that I was trained to be, which is to be there for my patients in the ER, to be there for them in the nursing home. It just happened to be on social media.
What's really cool, every time I've ever seen you in public, you're wearing scrubs, and I am glad to know you own other clothes. Or did you just go shopping?
It's usually because I'm always running to the hospital afterwards.
And it goes back to staffing and funding that Dara brought up, because yes, we would have loved to have been there, but Dara was in the ER taking care of patients, and I was a little bit busy myself. And so that's the challenge, is it does take funding and staffing to do these things.
Right down here.
Hi, my name is Anna. I'm doing Masters in Communications here, so therefore my question is related back to it. So given that many real doctors don't see themselves creating viral content and often distrust those who do, how should public health system adapt their communication strategies to fight misinformation? And do you see the possibility of building in new communication structures for future misinformation accidents?
I think collaboration's a really good word here. Collaborating with providers who are doing it well. I mean, I think there's just like an air of arrogance whenever social media is discussed in the healthcare space. It's medicine should be talked about in stuffy research institutions, only in medical journals, but that's not who that research is for. It's for the general public. And I remember being a med student in a room with the top subspecialist in the hospital, where they came in, they made the perfect diagnosis, they laid out the perfect treatment plan, gave options, walked out of the room, only to have the patient look at me and say, what did he say? So you can do all the great research in the world. We're talking about public health right now. Public health works, absolutely true. But our administration currently doesn't care about that. And they're winning. And the reason they're winning is because they've leveraged communication. They've leveraged the ability to get people angry.
But they leverage misinformation. They've leveraged viral content. They leverage rage and outrage. I think they're not giving accurate information, which is, I hate to break it to you, boring. Like, let's be honest. So, like,
but if it's boring, why do I have 100 million views per month on YouTube?
I don't know, Mike. Who wants Mike to be the next ASPA at HHS?
I mean, that's the problem.
I'm serious.
Everyone told me YouTube would fail unless I become like Dr. Oz. I start talking about how your zodiac sign impacts your heart health. I started becoming confrontational. I did none of that. We talked about the science. We understand that we needed to be relatable. We needed to be authentic. We need to own up to mistakes. We needed to make people laugh, cry, tell stories. Harness what those snake oil salesmen did so well and marketers do so well, but do it for evidence-based medicine.
Marketers, yeah. Education and collaboration are key. We need courses. There is actually, like I said, education, training, research behind this. Education and then collaboration, working with social media stars. My biggest tweets came, I tweeted the Oscars when I was Surgeon General. Got far more tweets than any public health thing that I ever did. Mike, his dog just died. The biggest tweet that I had as Surgeon General was a tweet of me and my dog Bella. And so really, like you said, collaborating, working with athletes. I do work now with the NFL and with the NBA. I'd rather have LeBron James or Tom Brady out there saying get vaccinated than having the Surgeon General of the United States out there saying get your flu shot.
So we're getting somewhere with some suggestions and some constructive ideas for where to go from here. But I wanted to see, just to poll you in general, do you have a fear of another big public health crisis coming? Do you see it forming already on the horizon, and do you think we're ready for it?
We're about to have nobody have insurance. I mean, let's talk about it, right? We're creating a public health crisis without needing a new pandemic. I mean, we can have a pandemic too, but we're about to see chronic disease skyrocket. We're about to see people have no primary care. We're going to see rural hospitals close. We don't need a new virus to actually cause another crisis of the public health system. We're creating it right now.
Hey, we have an
John.
old virus. I mean, NBC report, or Stanford report came out, was covered by NBC just earlier this week, talking about how most communities across America have dipped below herd immunity levels. So it might not be a new virus. It might be an old one that comes back to bite us.
So there's no question there will be another pandemic. We don't know when, from where, with what pathogen, but actually there are pandemics today. Around the world, cholera became pandemic 60 years ago, and it's spreading more because of climate change. If we stopped it, we'd get better at stopping pandemics. Hypertension is a pandemic. We don't see it that way because it's so common. But yes, there will be next pandemic. Lack of access to primary health care, lack of insurance, weak public health systems increase our pre-existing vulnerability, but we can overcome them. There is a commitment to be safer. There's interest in being healthier, but it's not going to be easy. And clearly, right now, what we're seeing is the hijacking of public health entities like CDC by individuals and groups that are spreading disinformation and misinformation. And to get past this moment in time, we're going to have to make alliances, speak clearly, reveal what the real economic drivers of their activities are, and level with people about what we know and don't know and what needs to be done.
Thank you for saying hypertension is a pandemic, because we're in this world where chronic disease is being pitted against infectious disease. And I think that's another communications challenge we have, but half of US adults have high blood pressure.
So you're going to be our last question, I believe. Please make it great. I say that because Tom's comment just now was like a perfect finish.
I can't ensure that it's a great question, but my name is Amir, and I'm one of a radiology fellow here at Hopkins. And so Dr. Frieden earlier stated that companies profit off of misinformation. What about social media companies and their algorithms? Are they responsible in any way for this pandemic failure?
Mike, this feels like a good question for you.
I think it's very complicated and requires a nuanced answer. In order to have free speech, in order to have scientific advancements, you need debate, you need discourse. The very first physician who said that doctors should wash their hands between the morgue and delivering babies was viewed as crazy. They beat him to death because they said, you're looking at your hands and you're imagining things there? Germs? What's that? So yes, sometimes revolutionary ideas are scary and they seem out there. So we can't stifle all conversation that disagrees with us. We need to be able to have that line between what is debate, what is good discourse, but approach it with a level of healthy skepticism. We can't expect social media companies to do that for us. We can expect basic decency to not cause outright harm of disinformation by lying to people. But by having innovative ideas and not censoring free speech, there is possibilities there. But if we overcorrect, we'll have situations where content like mine, where I was discussing ivermectin, hydroxychloroquine, the truth about eating disorders for teens, gets blocked simply because I was using those words. So while we want social media companies to take the helm in this regard, they're not medical agencies. They don't know what's right, what's wrong. But there are some that are doing it better than others. TikTok is a disaster. YouTube at least does the very minimum of saying that if someone's wearing a white coat or scrubs, they verify whether or not they're an actively practicing medical professional and have a license. So let's encourage them, instead of villainizing them, to maximize the benefits of social media instead of just magnifying the harms.
So I have to call it a wrap on the debate. I just want to say that, as a listener, as a non-expert in this, I learned a lot. I heard the things that you were bringing to the fore. I was really struck by and impressed by not only your call for humility, but your actual humility that you showed. I understand you're making a case for better communication repeatedly, and your unwillingness to say it's any one person's fault that things didn't go perfectly, that it's a sort of collective failure. You're not blaming the little guy whatsoever for being deceived or confused by what's happening in social media. You're talking about people who have more power, and you're looking for them to step up and do better. You're also talking about the need to spend money on the communication aspect and the need to be better prepared next time. I think for all of us, that was really a lot of learning, and I appreciate it. Before we wrap, there's one thing I want to say, is that we just wanted to make a point as an organization that when we're talking about failures and fault, we were never referencing the people who are on the front line. I'm married to one of them. And what I'd like to do is to thank them for what they did 4 years ago. I also I want to thank our partners, the Stavros Niarchos Foundation, Agora Institute at Johns Hopkins School of Nursing, and our philanthropic supporters that are open to debate, especially our founder and chairman, Robert Rosenkranz, and the Rosenkranz Foundation. And a thank you to you, our audience. And I would like to ask our four debaters to come up, just stand next to one another, because the people I really, really want to thank are the four of you. We like to end things with a handshake.
Yeah.
So if you wouldn't mind.
Can we just hug? Is that okay?
Kumbaya circle.
Yeah, there we go.
Thank you, everybody.